Over the last, I'd say 10 to 12 years, there's really been a change in the way that hospital care has been delivered. It used to be that most people had a single doctor that followed them for all of their problems, and if they had to be hospitalized, then that doctor would come to the hospital and take care of them while they were there and then continue to follow them as an outpatient. That model has changed some over time. The more common model these days is that physicians tend to be primarily either outpatient or inpatient based. The need that spawned us to pursue this project was the ability and the desire to be more proactive about how we communicated across those transitions in care. For example, it would often occur that a child would get admitted to the hospital, we would take care of them, we would try to make contact with the outpatient physician when they went home, but weren't always able to, sometimes too busy, sometimes it's hard to get in touch with the person you're trying to find. And so it was an imperfect system. And that led to uncomfortable moments sometimes when the child would show back up in the primary care physician's office for follow-up care, and their physician would sometimes not even know they'd been in the hospital. So that was the problem we were kind of looking to solve within the healthcare industry.
I'm Larry Mann. I'm a general pediatrician in Raleigh, North Carolina. One of the ways that Axial Alert has helped us as a practice is we're seeing right away that the patient has been seen and managed. We know what the diagnosis was, we know what the medications prescribed was, we know the disposition of the patient, whether the patient was sent home or whether the patient was admitted. We're also sent a notification and given details of that admission, and then when a patient's discharged from the hospital, we're sent an alert to allow us to know when the patient was discharged. So when the patient comes in, we have the information available to us to make a decision because we have had the information available to us ahead of time.
I think the thing that's been very useful for us about working with Axial Exchange is that what we were looking for was kind of a unique solution to a fairly common problem, and we didn't see a lot out there that solved this problem for us in an elegant way. But what the application does is it sits inside the network at our hospital and monitors the network traffic around patients. It's looking for certain events that we've defined ahead of time. In our case, registration in the emergency department, or admission to the hospital, or discharge from the hospital. Those were the biggest things that the outpatient physicians wanted to know about when their patients had a contact with our system. I think we appreciated the fact that Axial, being somewhat smaller, is able to be responsive, to listen to our requirements, to get to know our business needs, and then help us solve that in a little more personalized fashion and be a little bit more responsive than a larger HIT vendor might be.